All right, so thank you all so much for joining us for the Keys to Sustainability webinar today. We're really excited. We have one external speaker, and then we're actually going to have one of our fellow grantees share some successes she's been having around fundraising. So the purpose of today's webinar really is around how can we start thinking about funding post CDRI grant period. So as you are all, I'm sure, aware, July 31st will be the last day, quote unquote, for the participation period for this year one funding. So we want to start supporting you all and making sure that you have some ideas and strategies to continue your success in your respective programs. I did, before we go ahead and get started, just want to give a reminder. I know there has been a little bit of confusion with the release of our next year request for applications for year two CDRI funding. As a reminder, as I've mentioned in a few of my update emails, that is not eligible to any of you all. We will be opening up continuation awards for this group. That application will open on May 1st and it'll close on May 30th. I will be sending some more information closer to that date for what that application is and how you will all access it. So just as a reminder, please do not submit an application for the normal year two funding that is due on April 24th. There will be more information for your continuation opportunities there. So with that said, I'd like to go ahead and turn it over to our first speaker. So we have Ashley Stevens on the call. She is a social services program coordinator for North Carolina Department of Health and Human Services, specifically for Project CARE. So Ashley, I'm going to go ahead and turn it to you and let you take the reins.
Okay, thank you so much. And let me go ahead and share my screen.
Wait, no, up there. Way up there.
Okay, and are you able to see the screen okay?
Yep, we're good.
Awesome. All right. So let me go ahead and get started. Okay, so again, thank you for having me here today, Isabella, and really excited to talk with all of you. My name is Ashley Stevens. As she mentioned, I am a gerontological social worker, and my work focuses on supporting caregivers and families impacted by dementia. I work in a really great program called Project CARE, which we'll discuss that a little bit later. And then on my downtime, I have a social media platform called the Dementia Guru that just provides education and support to caregiving families and the community. But today, I'm really here to talk about something that I'm sure is probably on all of your minds, which is sustainability. You all have been doing incredible work providing respite to caregivers through the CDRI grant. And so, of course, as you approach July 31st, one big question that might be coming up is what happens next? And how do we ensure that respite continues for caregivers who truly rely on it in order to provide the best care for their loved ones? So that's what we will talk about today. I'll briefly walk you through some funding sources beyond CDRI, ways to help your caregivers feel a little bit more empowered to access support themselves, and then strategies to keep your programs running long term. But before we get into all of that, I want us to take a step back and really think about what's really at stake here. So I want you to think about your caregivers. Take a moment and think about who are the caregivers that you're serving, and imagine that a caregiver named Martha, she's been bringing her husband to your respite program for the past several months. And of course, thanks to your wonderful services, she's finally able to have just a few hours to herself. She's able to go to her own doctor's appointments. She has some time to run errands, maybe go grocery shopping. She started pampering herself. She's getting her hair done. She's getting her nails done. Go, Martha. We're happy for Martha. She's even told you that she feels like she can finally just breathe again. But on March 1st, or August 1st, sorry, the funding is going to be gone. So there's no more respite. And Martha is kind of at a place where she doesn't know how she's going to be able to afford care on her own. And she's just exhausted trying to think about it and feeling like she has to start from scratch. So let me know in the chat. I want you to kind of talk with me. Does Martha's story sound familiar to you? Do you work with caregivers who are sometimes having a hard time thinking about what their next option is going to be when it comes to funding? Okay, I see Becky in the chat. Yes. Okay, so this sounds familiar, very familiar. Okay, so this is not a hypothetical story. Martha is maybe very similar to the caregivers you're serving, or maybe even you're Martha as a caregiver. I know a lot of us are also caregivers in the work that we do. So the good news is that we can help Martha tap into other resources, help to educate her on how she can access support and funding. So, like I said, Martha's story is not unfamiliar. There's countless other caregivers who we work with who are left to just figure out how to find that funding support, and we do not want that to happen. So, let's talk a little bit about the impact. And I see some of you still in the chat saying this is very familiar to you. You can definitely relate. So, that's good. So when funding ends, we know that that can certainly lead to burnout. Many caregivers, they've really built their schedules around respite services. And so when that funding ends, they are just suddenly left scrambling, trying to find alternatives. And a lot of times caregivers feel like they are right back at square one. One caregiver that works in my program called Project Care, they expressed to us that I feel like I'm running a race and I can't quite seem to see that finish line. And it feels like, okay, once I get some services in place, they just end and I'm back to square one. I can't see that finish line. I'm just running this endless race. And so that's something common that we come across with a lot of the caregivers we're working with. And that can lead to higher rates of stress and depression and anxiety. And then when funding ends, it also puts families in crisis situations. So those family caregivers who might lack social supports and respite, they face higher rates of stress, and that could lead to increased risk for ER visits, hospitalizations, and even potential long-term care placement. And a lot of families, at least in my program, they prefer to stay at home. They prefer to keep their loved one in the home, but sometimes that's not an option when respite supports are not in place. And then also service disruption. So when funding and programming is disrupted, this has an entire impact on the family system. So I'm the social worker, as you heard me mention earlier, and we are really focused. Our foundation is all about families and family dynamics and family systems. And so what we see in caregiving is that the entire family is impacted by service disruption or a change in the care delivery that they're receiving. And so not just the caregiver is being impacted, but also the person living with the dementia as well. Okay. And one of the biggest challenges caregivers face when funding ends is simply just not really knowing what their options are. So they may have a limited awareness of the alternative funding options that are available. So a lot of caregivers, like Martha that I mentioned earlier, they don't even know about funding sources like Medicaid or how to access Medicaid or VA benefits or how to make that application or maybe other local grants that might be available in their county. And so when caregivers don't know about funding options or have access to that, they're more likely to stop using respite altogether. And that's certainly not what we want. Caregivers also might feel the process is a bit overwhelming or time consuming. We know that caregivers do not have time to waste. They are busy providing the best care that they can. And so when there are processes and complicated applications and eligibility requirements, that makes it very difficult for them. And they might not even try because it's too complicated. And then also communities of color and rural communities. So these communities might face disparities when trying to access resources and funding and maybe not know what's actually available. And so these are all of the reasons that folks may not be able to access the resources that are actually available. And you might be saying, well, okay, why does this even matter? Why is this important? It matters because if we don't start planning now, which is really important because July is going to be here before we know it. If you don't start planning now, caregivers are going to face that abrupt loss of services. And you, as organizations and providers, might also be scrambling to find some of those last minute solutions. And so we want to try to avoid that. We want to seek some opportunities to close these gaps that I'm mentioning and make sure that we understand what funding sources are available, and then giving our caregivers the education and the tools so that they feel empowered to actually seek that funding themselves. And then, of course, we also want to make sure that we are building some strong partnerships locally so that we know what's available and we know how to speak to that and refer our caregivers appropriately. And I want to say, too, it's not just about your programs being sustainable and securing funding. That's very important. But what this is really about is truly protecting caregivers. We're protecting dementia care families. And when we kind of frame it in that way, it helps us to really understand the critical need. And it helps us to speak better to that whenever we are talking to stakeholders or we're talking to our community partners on why they should value respite care and invest in it for our caregivers. It's a critical need, and we are really protecting our caregiving families. All right, so what can we do? There's a few funding sources that I want to cover today. Not all of them, but just a few that might be helpful to you all, and probably some that you're already familiar with, or maybe you've already tapped into. So that's great if you have, but if not, definitely take some notes. And I want you to also, if you have any questions, also just drop that in the chat. We can kind of open it up for questions as I'm going through some of these funding sources. So we have the Family Caregiver Support Program, the Lifespan Respite Program, the Hilarity for Charity HFC Respite Program, and programs like mine, North Carolina Project Care, and then I'll talk about some others as well. Okay, so the Family Caregiver Support Program, how many of you are familiar with that, or you work in that program, or you maybe already partner with your local Family Caregiver Support Program? Let me know. Okay, so not familiar. Great. Okay, here we go.
Yeah, I see one thumbs up.
Oh, good. Okay. I can't see all of you in the boxes because I'm like going from the presentation to Zoom. But I'm glad to hear that some of you are familiar. It looks like some of you are not so familiar. So let's just do a high level overview of the program. So it is a federal initiative under the Older Americans Act aimed at assisting caregivers of older adults age 60 and older. And it also supports caregivers caring for a loved one with some form of dementia. So that is who qualifies for this program. And what does it cover? It covers services such as respite care, counseling, education, even support groups are available. How do you access it? You want to connect your caregivers to their local area agency on aging. Hopefully, you all already have some connections with your AAA. If not, that is a really, really great starting point. You want to make sure you're partnering with them very closely because a lot of these services and funding sources come directly from the AAA. You can also connect your caregivers to their local council on aging, Department of Social Services, or aging services. And I add that in there because even though here locally in Mecklenburg County, where I'm at, even though our AAA kind of disperses the money out to the counties, then at the county level, they deliver or allocate those funds a little bit differently. And so I work out of a Department of Social Services, and we have an entire division focused on services for adults and for older adults. And so that might be the same case where you're located. And so you don't want to just stop at your local AAA. You also want to dig a little bit deeper and see if maybe there's some services available at your local DSS, Council on Aging, and other aging providers in your community. What I want to share with each of these programs is like a key tip. So the key tip here is basically that funding varies by region. So you want to encourage your caregivers to apply for these programs early. You want to also, like I mentioned earlier, just make sure you're partnering closely with these entities so that you're actually aware of the funding cycles, when they begin, when they end, and how caregivers can really maximize the program funding. So, for example, like I mentioned here in Mecklenburg County, where I'm located, our fiscal year begins July 1, ends July 30th, June 30th of the following year. So funding typically runs out a little bit before June. So we try to communicate that to our providers, communicate that to our caregivers, encourage the caregivers to really tap into all of the programs available and know that timing, it can be a little bit of a game. And so that's why it's helpful for you as their support to know that, so that you can clearly direct them on the right path. And for me, like I tell my family caregivers, hey, there's a wait list in this county. You definitely want to get on that wait list sooner than later. So maybe don't wait until the new fiscal year begins. And I'm only really able to make those recommendations because I'm plugged in and I partner with these entities. So I work very closely with the AAA here, very closely with our other county providers and partners, just so that I'm aware, I'm staying abreast of what's available, or if something changes, if funding increases, that's even better to have that information and be able to share that with caregivers. So that's the key tip on this one. And let me see the chat. Do you know what's going on with the reauthorization of the Older Americans Act? I do not. That's a great question. I don't have information on that. Katie, were you going to say something?
I was going to
Go
jump
ahead.
in.
Go ahead, Sarah.
Hi, Sarah.
Hey, Ashley. So just some information. What we do know about the reauthorization of the Older Americans Act. On Friday, the Senate passed a 6-month continuing resolution to fund the government until the end of September. So that means that our Older Americans Act programs are going to continue to be funded at the levels they are currently funded for the next 6 months. So we don't really have any long-standing information, but that's where we are currently.
Okay, good to know. And you said for 6 months at least. So,
Yeah, 6 months.
okay, great. Thank you. Okay, let's go to our next program, Lifespan Respite Program. Let me know in the chat if you are familiar with this program, another really great program that focuses on family caregivers, and it's across the lifespan. So this program is for caregivers caring for children, caring for adults across all age groups, all disabilities, and all chronic conditions. So that is who will qualify for this program. Okay, I'm seeing in the chat a few know of it, a few don't. Good, okay. And so in North Carolina, we can receive up to $750 in respite care in a calendar year. So that's a great amount. I mean, it's not a large amount, but it's something to get caregivers a little bit of a break that they deserve. It covers respite care services, so that's in-home care, adult day services, short-term stays at a long-term care community. And so to access it, it is a coordinated state system. So it's going to differ by each state, of course. That's kind of like a theme here. Everybody does everything differently. I wish it was more streamlined, but that's usually not the case. So check with your local state contact, find out who that is. So in North Carolina, we apply online. There's an application, but we have to also do the application with the caregiver. So the caregiver cannot just apply on their own behalf. As a provider, referring agency, we have to complete the application alongside the caregiver. The key tip for this program, like I already said, is really just understanding that each state program looks very different. So, like I said, in North Carolina, we get up to $750 in reimbursement. In Virginia, it's $595, I believe. In Ohio, where I'm from, it's $500. So the amounts are going to look different, how it's dispersed, the time frame for how long caregivers can use it, that's also going to look different. So you want to just be sure that you reach out locally to your contact or representative so you can understand how they disperse the dollars. And funding is usually limited, like with the other program I mentioned. It's on a first come, first served basis. So you want to make sure caregivers are applying early. Any questions about that program? Lifespan respite. Okay, let's keep going. So Hilarity for Charity, HSC, respite grant, great organization. They have respite grants to primary caregivers of folks who are living with dementia, some form of dementia. So that's who qualifies. They have to have a formal diagnosis, living in the home with their care partner and residing in the United States or Canada. So they're a little bit more expansive. It covers the cost of professional in-home care or adult day services. And this was news to me because I believe it used to be just in-home care. So they've grown a little bit, and now it's 2 types of awards. So the caregiver can choose between in-home care, which would be up to 100 hours, and then, or they could choose adult day center option, and that would be 24 days over the time period of 3 months. So they can access that application on the HSC website. The key tip for this one is that HFC works with a preferred provider. So that preferred provider is Home Instead. So they coordinate the in-home care that's awarded through Home Instead. So that is the in-home care agency that would be delivering the care in the home or the respite. There's no cash value for the respite, and it's a very specific time frame that the funding has to be utilized. So that's important to know, and important that the caregiver understands that they have to use that preferred provider with Home Instead. The other programs, well, at least my program that I'm getting ready to talk about, we're a little bit more flexible where you can choose your provider because maybe cousin Billy does much better with mom who's living with dementia. Maybe mom responds better to cousin Billy. And so we try to be flexible to meet the needs of the caregiver and the care recipient. But also with the in-home care agency, they might have more training and they might have some of those background checks and some of those things that need to be in place in order to feel more comfortable with who's providing care for their loved ones. So there's pros and cons to it, just making sure that the caregivers understand that. Okay, and I see some chat. Okay, I think HFC in home has to be with home care assistance though. Didn't know the ADC can't. Yeah, so that's updated. And I just got this from their contact there. So I know this is updated information. And then more on lifespan. Thank you, Sarah. Awesome. And I'm gonna try to give you guys a just a brief like resource, not an infographic, but resource guide at the end with some links as well. So I think actually, Sarah, those are the links that I have in there. So that's perfect. Great. Okay, next one, NC Project Care, my favorite. So this program is specific to North Carolina. The CARE acronym stands for Caregiver Alternatives to Running on Empty. I just love that so much. Figuring out alternatives so that our caregivers can see that finish line that I was talking about earlier. state-funded program. It is dementia specific, so it's for family caregivers caring for a loved one with some form of dementia. So to qualify, they have to have a formal diagnosis. They have to be living in a home with their loved one and needing assistance with activities of daily living. So what does it cover? We cover respite care services in home. I always like to say our program is kind of like twofold. We have the cake, which is care management, where we provide coaching, counseling, disease education. We develop care plans. We help caregivers develop coping skills and really guide them through navigating some of these services. And then the icing on the cake is the respite care, where they can actually have some funding to take the break that they really need. And so they can use that with in-home care, they could use it with an adult day center, or maybe even a private care aid like Cousin Billy. And how they can access it, they can contact their local area agency on aging. Here it's NCDHHS to locate who the regional lead is, because we have I think it's about 7 of us who are leading this throughout the state of North Carolina. The key tip here is that this is a North Carolina state program, but there may be similar dementia-specific programs in your state. So, for example, in Florida, their dementia-specific program I learned is called Project Relief. Who knew? In Wyoming, they call their program Wyoming Dementia Care Program, and that provides free respite to dementia-specific care families. So really want to encourage you all to reach out to your local area agency on aging. You can even maybe reach out to your local chapter of the Alzheimer's Association. They might be aware of dementia-specific grants that are in your state. And then, like I mentioned before, you want to find out locally who that contact might be, and they might have more information about dementia-specific grants. Any questions about that? Not seeing any. Okay. And then just some additional publicly funded services I'm sure you all are very aware of: Medicaid, home and community-based services. There's block grants that are available, and the eligibility for Medicaid is very specific. It is for low-income families requiring nursing home level care, so that's important to know. But such a great resource if families do qualify. A lot of families I work with, they don't qualify because they make a little bit too much. They're kind of falling in that gap. But for those families that do qualify, it's great because they could maybe receive personal care services in the home. They could, maybe even the caregivers could be paid for the care that they're providing in the home. So definitely want to get them connected in the event they might qualify. And then I wanted to mention the VA aid and attendance benefit. That's a great program as well for veterans and surviving spouses, and that can be used for personal care services in the home as well. The key tip with these programs, I mentioned this with Medicaid, these programs can be very complex and eligibility is very specific. So you want to make sure you understand how to appropriately refer someone. We don't want to send caregivers into a dead end. We want to make sure we know what some of those eligibility requirements are, or at least have a contact that you can reach out to and refer those caregivers directly to. I think that this could also be a really good opportunity for you to offer maybe a workshop where you host a workshop on some of these programs locally and have a local contact come there to really educate you and educate the caregivers about their program and how to navigate it. I also facilitate a couple of African American support groups, and that is exactly what we did. We hosted a few workshops, we've had different speakers come in, and just really help the caregivers understand how they can navigate these programs and access them. So just keep that in mind as a way for you to also give those tools to your caregivers. Okay, and so we want to talk a little bit about strategies for sustainability. I know we've been talking a lot about securing or about the programs. Now we want to talk about securing that funding. And I think this really is important to talk about being intentional about how you're going to implement these strategies. So, number one, you want to build partnerships. I've mentioned that a lot, especially with the local area agency on aging. You want to collaborate with them, other community organizations, even your universities. They might have a vested interest in some of these programs that you're doing, local adult day center services, partnering with them. These organizations can really provide some resources. They can do some of those trainings. They can come out, speak to your caregivers, and it could also be potential for funding opportunities as well. So definitely think about leveraging your community networks and brainstorming on potential ways that you guys might partner together. Um, I also want to encourage you to think outside of the box. So I mentioned the AAA and the Alzheimer's Association and adult day centers, but you also can start partnering with other organizations that may be not directly in aging or caregiving services, but maybe they align with your mission. And so you could consider partnering with maybe your local library or a local faith community, even your local art museum. That's something that I did a few years ago here in Charlotte. It was a really fun partnership with one of our museums uptown. And it actually was a nationwide movement called Meet Me at MoMA, I believe. And they wanted to create space for people living with dementia and their care partners to be able to access the museum and access art and talk about art and have activities at the museum. And so that was a really great opportunity to partner with the museum. Maybe not a organization that I would have thought of partnering with before, but turned out to be a really unique way that we worked together and provided programming and events that was specifically for family caregivers and folks living with dementia. So I say all of that to say, just don't be afraid to think outside of the box when we are thinking about building partnerships. And then the next one, diversifying your funding stream. So really sit down, again, being intentional, sit down with your team and develop a comprehensive funding plan. Plan to diversify through different streams of funding. So that could be grants, donors, fundraising efforts, which I know we're going to be talking about later, even earned income. So, for example, you could consider offering fee-based workshops or maybe even conferences for professionals. You could also offer fee-based products related to your mission. Maybe it's buttons or t-shirts that you sell. So just get creative. And again, thinking outside of the box as far as how you can continue to increase that funding. And then the third one, connecting empowered caregivers. This one is really important. And I kind of mentioned it a little bit earlier, especially when talking about Martha and her story after she attended your program. She felt so relieved. She said she could breathe again. And so we want to continue providing that support to Martha and giving her the tools and the resources so that she's able to empower herself to tap into additional funding that might be available. And I always say that, like, we are not empowering caregivers. We are just supporting them. We are providing the tools and the supports and the resources so that they can empower themselves. Because once we are out of the picture, once funding is gone, we don't want caregivers to be left in the dust and them depending on us in order to access their support and their funding. And so we want to also educate caregivers on how they can tap into these resources. And again, some examples of that would be hosting workshops, making sure that caregivers have the maybe educational tools or handouts that you might create that really helps them to navigate each program, know who they're going to contact. I think the workshop is really a great option or a great starting point because at least they can put a name to a face and be able to talk to that individual, ask them specific questions, and then they might feel more confident to reach out to that individual down the road when they do need some support. So just want to think about how we can provide those tools for caregivers to use themselves. Okay, and then lastly, demonstrating impact. This one's really important as well. So we all have really amazing and triumphant stories of caregivers like Martha who are accessing our programs and services. We just want to make sure that we can speak to that and we can share these stories. So make sure you're collecting the data and you're sharing it. You could use surveys, you could use testimonials, case studies. Just make sure that you're finding ways to showcase the effectiveness of your program. Okay, so I'm going to stop here because I know we're getting past time a little bit, but just want to thank you all as well. I want to take a moment to thank you all for the work that you are doing to support caregivers and people living with dementia. Just encourage you to keep doing the great work that you are doing and continue equipping our family caregivers with the tools and the resources that they can feel more confident in their role, and they won't have to ask you what happens next come August or July. They'll already know and they'll already have that confidence to be able to step into their caregiving role successfully. Okay, so we can open it up for questions, or I'm not sure if we're going to transition to the other speaker and save questions for the end, but thank you. Oh, okay, we have a question. Catherine.
Hi there. Thank you so much for this presentation, Ashley. I'm in the Central Coast in California, and we have a really great funder who provides respite grants for in-home care and adult daycare. The funder funds our day center, but also provides additional grants for other places along or in our Tri-Counties area, and the in-home care element. For some reason, it is just so difficult to get people to take this free money. The grant actually used to be administered out of the Alzheimer's Association while I was working there, and we had the same problem where it really is, it's a simple application process reviewed in-house. We have the program now administered out of my day program. Requirements are really a dementia diagnosis and being low resource, just a simple process, to me, very simple and free money. I think that maybe the concern is people feel that what's the catch to it? It is a reimbursement grant as well. But just wondering if you've experienced that, any ideas? I mean, we've invested in the marketing for it, meet with families, go through it, just getting them to follow up. I know they're busy with a lot, but anyways, any thoughts or experiences about that?
Yes, thank you for pointing that out. I have definitely experienced that as well. And that's why with my program project here, I really do feel that the model is so beneficial because it's not just the funding, it's not just the free money, it's also the care management piece. And that care management piece, we are really, peeling back the layers, and we are really talking about giving yourself permission to even take a break. A lot of caregivers don't even feel that they deserve the break, or maybe it's their first time even reaching out for support. And so it's hard to reach out. It's hard to accept the help. It's hard to ask for the help. There's a lot of stigma around it as well. So that care management piece, I believe, really does help us to work through some of that and to help caregivers process not just the disease, but their emotional state and how they're coping with it and how they allow themselves, give themselves permission to take that break and to use that funding. And even with care management, it's still sometimes complicated and challenging, but I think that is a huge reason why more caregivers utilize the funding in our program. I always call it chasing caregivers, like I'm chasing them to spend this money, like, hey, don't forget, spend this money. It's here for you. And then being that support for them, like, how can I help you maximize your respite time? And so, again, the care management, we're talking about the value of respite, the impact of respite, what that looks like, and what is most meaningful to you as a caregiver. So, if respite and taking a break just looks like taking a nap, then great. Let's schedule the respite time and the funding around that. If it looks like, I had another caregiver recently, she was able to go to the dentist for the first time in years. She was like, I'm just going to use this to go to the dentist because my teeth are just, they need it. And so that was how she used the respite. So being able to work with those caregivers and help them really get down to what the need is, and then help them very specifically map out how they're going to use the respite, that is also helpful.
Yeah.
Any other questions? Okay, see, Autumn, I really appreciate this, Ashley. Oh, good. The care management piece for the family caregivers is a big part of our program. Awesome. I love to hear that. And whoever your folks are who are delivering the care management, make sure you check in with them. Make sure that you're offering them ongoing support, ongoing education, because there's also a thing such as secondary trauma. And we want to make sure that our helping folks, our social workers, our care managers, they have the training and the tools to be able to successfully support caregivers.
All right. Well, thank you so much, Ashley. If anyone has any other additional questions for Ashley, she has graciously shared her contact information here. We will make sure you get this recording and have this presentation as well, so you have it if you would like to reach out and ask any more questions. She's more than willing to help assist. But thank you so much for being here, Ashley, and sharing your wisdom and expertise with this group. We really appreciate it.
Yes, and I'll send this to you so everyone at least has the links for some of these programs I mentioned.
Fantastic. Thank you. All right. So we have about 15 minutes left. So now I'd love to turn it over to Latina, who, if you are not familiar with what program she's with, she is with Metropolitan Better Living in Oklahoma City. She is going to share, she has been a rock star fundraiser and top of all of the other things that are happening. So I thought it'd be a really good opportunity if maybe you haven't dipped your toes into fundraising, or maybe you are and you need some good new strategies or just new rejuvenation, wanted to bring her to the table to share some of her successes. So Latina, I'll turn it over to you.
Yes. So as you all know, I'm Latina Eatman, and I have really been focusing on sustaining what we have once the CDRI program funding has ended. And the best way that I found to do that is, again, Ashley pointed out everything that needs to be done. But what I identified, if we take it in pieces, right? So we're not looking for a funder to fund everything. So I have identified through our Arts Council, which I think each state have one. I was doing a little research. The Art Council, they support activities. They have grants that will give you money for activities. Senior specific activities. The Oklahoma City Community Foundation, which I've also identified as in different states. So your local city community foundation have these grants, like it was an iFund grant. They were able to fund our exercise program, right? Because they were based on senior wellness. So they were able to assist with funding nutrition and exercises. All that is enhancing your program offerings, right? And when you enhance your program offering, more people are becoming more familiar with you because you become unique in your service offering. And I found that to be very essential. And when it comes to fundraising, one moment, I'm on a Zoom, one moment. And when it comes to fundraising, It's gonna be like 30 minutes. Okay. I don't. I'm sorry. And when it comes, you guys, I'm so sorry. We're like a non-traditional place here. So when it comes to fundraising, what we've done is it's not, it doesn't bring in much, but we do a lot of lunch and learns, right? Because we want to inform the caregivers of what resources are out there. We do monthly newsletters for caregivers, like, updated information, resources they can go after. But we do like baskets, right? You get your local community to donate like different items, small items. You got to be real intentional about speaking up your program, letting them know the actionable outcomes of your program. I find that to be always the most beneficial way to get my approvals, letting them know what demographic of people I'm helping, how we're helping this demographic of people, um, the things that is lacking, how it's affecting state numbers and state money. And so when you give that information to them, everyone is willing to help. We've also partnered with like the United Way. So we're now a United Way partner. And with United Way, they give you they support you in operations, right? Based on your budget, a percentage of your budget they give you for operations. And then they have campaigns they run for you. So you become an agency that people can do deductions from their payroll checks for your organization. Like they pick the organization that they want to do their payroll check deductions for. So that's sustainable, right? Also, when I mentioned the local and then taking it in pieces, Arts Councils help support activities. Then we partner with Goodwill, right? Goodwill had a program where they would come in and teach our seniors computers, right? Basic knowledge of computers. Everything that they're limited in access, when they have limited access for, we try to create something where they can receive that access, and everything is available to caregivers because of the population we serve. And you got to be culturally sensitive, right? Because different cultures require different things, and it helps you to be innovative when you understand the need of your community, right? And you're able to articulate it to your community. We call representatives in, right? And because representatives are not very familiar with what we do in our center, right? So once we called a representative in, told them what we're doing, what issues we're addressing, barriers we're addressing. Do you know one of our representatives went out and championed, because we did have that the respite vouchers that I think Ashley had spoke about, but ours is through Oklahoma Cares. They were giving like $375, right, for a day of respite, which I mean, I don't know if it's for the week or the day, but they were just giving them $375 for the month of respite, which was barely anything, right? So we were talking to our representative about that, because we bring them in, we let them see our community, let them see what the work that we're doing, let them talk to some of our caregivers, and they go back and create initiatives to help support your initiative. So it's like building those relationships are so important. Uh, we have a senior wellness center and the Oklahoma City memory care. I don't know if your state have a memory care. I know hospitals have it. Hospitals have memory care centers, right? They got a federal grant. They asked us to partner with them as a subrecipient. So in turn, they'll get clients, and then we can give them the practical aspect of what they're missing from research that they're trying to do on the primary population we serve. So there again, that's financial support right there for us. Um, um, yeah, let me see. Advantage waiver. I don't know if you guys are familiar. It's the Medicaid program, but we have the Advantage waiver program. And filling out the application and being certified through the Advantage waiver to offer Advantage waiver services, we get a certain, I think it's like up to $91.50 a day for adult day services, up to 8 hours a day. And the VA give it was like 114.75 for 8 hours of adult daycare, $40.17 round trip for transportation that you can bill on. So just getting those partnership and relationships with these agencies that are trying to find services for these individuals with Alzheimer's and dementia and other various aging diseases, because we even threw in the fact that we want to support the underlying conditions before it becomes a bigger condition, if that makes any sense. So that's pretty much what I do. Bringing away. And then when you start putting your name out there and start applying for these grants, even if you're not approved the first time and you keep approving, your name becomes familiar with them. And once they've approved you for one grant, they're emailing you every time there's a new grant opening. And then we can apply for that. We've gotten 3 from the Oklahoma City Community Foundation. We just got one it was $25,000 to do 4 lunch and learns just to educate our community on our service offerings, right? It's so many things you can tap into, but like Ashley said, you have to be intentional. You can't just sit and wait for it to come to you. You just get out there, and especially if it's people doing the same things you're doing, senior care, dementia specific care. We got senior wellness centers that's partnered with us, gave us a big break. The memberships were like $25 for seniors, and you have to be 50 and up to attend. We got it down to $5 for our participants who wanted to go and enjoy the senior wellness center, because I did mention to them they missed a marketing gap though. You guys call this a senior wellness center for everyone, but it's not holistic, right? You can't bring people who have these memory barriers, who have cognitive and physical challenges, those who need that extra support to enjoy that type of center. So we offered another partnership. Okay, well, we have all of our aides here that work at our adult day center are certified aides. So now you got this unique population that can come enjoy your center with the help of our aides. And then in turn, when they have funding opportunities open, they always want to, hey, will you guys help us with this? Will you guys help us with this grant? They start asking us to be a part of their grants. It's just letting them know how essential you and your services are to your state, to your community, the people whose lives you're changing, the caregiver supports you're giving, you're reducing numbers. Like I tell you, Oklahoma have high numbers in all the bad areas. We have the highest incarceration rates. We have the highest number of like caregiver burnout. Like our senior population is superseding our young adult population. So now they're all in a frenzy. Like, what can we do with these seniors? What are we going to do with these seniors? You be that person that can answer that question for him. So, hey, we can help this type of population. You just got to be vocal. You got to be, and I'm telling you, we are like the worst when it comes to our website and social media, but we are one of the best when it's about boots on ground, being in the grocery store, seeing a person walking with someone, seeing someone a little stressed out, seeing someone coming out the senior center, going to these churches and talking about our services. That's a big key thing, that you can reach a large amount of people going into your local community churches and getting the pastors on your side and pumping your initiative. That brings so much more notoriety and funding opportunities to your facility. I hope that helps.
All right. Thank you so much, Latina. We really appreciate that. And I echo Shelly's comment in the chat around your energy. We always love your energy.